Hi, Heather. Amy Bell. I enjoyed reading your post on gathering information on the mental health needs and services, and that acknowledging that there's many barriers to implementing new policies um, within low to middle income countries. Um, Specific barriers that you mentioned was the impact of income on the mental health. And when I read this, it made me think back to chapter 9, Malik Daniels, McBain, and Morris's chapter on global mental health resources, and the discussion in their chapter on page 173 regarding the GAP Action Program, which is part of the World Health Organization's Mental Health GAP Action Program to decentralize mental health resources and shifting treatment more from institutionalized settings and implementing more of an integrated approach, um, providing those mental health resources through what would be considered alternative means, through community health resources, through community programs, things of that nature. As I read more on low and middle income countries and the struggles that they have with human resources and with cost effective measures, it seems logical to me that the more you could implement into community resources and the more that you could um, share that burden of responsibility with different stakeholders in the community, um, whether it be through primary care, whether it be through volunteer organizations, whether it be through volunteer mental health organizations. I think that would help to um, ease some of the burden when it comes to income, but then also build a group of human resource professionals that could help with mental health causes in some of these countries where things are lacking. The other thing I also thought about is in chapter 13, I believe it is. It's Lund, Caldas Almeida, Whiteford, and Mahoney. The idea of um, bringing in the different resources into the community and implementing um, regional networks, implementing, even if you used um, scaling up services like discussed with Eaton, um, just as how we're doing, how we are taking classes online and we are building our repertoire online, offering these same types of services um, to low and middle income countries to help build their resources. Um, I think this could be something that could be beneficial to them, hopefully, and to help build their group of professionals who can work with those with mental health needs. Even if you're bringing in consultants from, just as we use telehealth here, bring telehealth into some of these lower and middle income countries to help aid their patients and their families who are struggling with mental health issues. This is such a huge topic to discuss, as one I think that we could spend a lot of time and thoughts on how best to implement strategies for these countries that are definitely lacking in services, and quite frankly, here in the United States, in areas that are remote that do not have access to the health care that some of our more urban cities have access to. Again, I enjoyed reading your post. It really made me think about different options that could be implemented. I hope you have a great week, Amy.